before we implemented our advanced care planning coordinator and this work, we had about 10% of the patients that were in the hospital at any given time had advanced directives on file in our EMR. Currently, that's about 35%. So we have really increased the number of patients who are in our hospital who have advanced directives. We were able to look at what we are doing or were doing at the time in regards to advanced care planning and assess what was working and what wasn't working. And out of that, we have really helped to develop a number of different things. One of them is we created a advanced care planning coordinator. And this is a person, a full-time staff member who works in the hospital, who is able to visit with families and patients at the bedside and talk with them if they don't already have an advanced directive about what it is and why it's important, and encourage them to complete one. And in fact, work with them on developing one if that's their choice. One of the other really, I feel, great successes that we've had is figured out how then to make sure that document was visible and accessible to the medical care team in our electronic medical record. So for those of you who are not familiar with electronic medical records, they can have a lot of information, and it is often very difficult to find what you want easily. And when we have care providers, medical care providers who are trying to make decisions, treatment decisions, they don't always have the luxury of looking through several different things within the record till they can find what they want and what they need. So we were able to work with the Johns Hopkins system to develop a space within the medical record that really just tracks all kind of advanced care planning. So there's a number of different items in there, but one of them is advanced directives. So it's been a great success, and that's feedback that we've heard from our medical providers, that they can now easily find the document and they are able to easily identify what is the most recent document. That might not sound like a heavy lift, but it is. So we at Howard County General Hospital are part of the Johns Hopkins health system, and anytime you make changes in your electronic medical record, you have to make them at the system level. So there are layers of approval that are required to make that happen. And there's different responsibilities among the folks that work within the medical record to get each thing built. So it's far more complex than I had imagined when we first asked about it. So that was a huge success. One of the other things that we've done is we've really tried to carry the work that we do with patients outside of the hospital bed. So within our hospital system, we have some ambulatory or outpatient programs, like we have cardiac and pulmonary rehab program, and our advanced care coordinator goes and talks with them when they are doing the classroom portion of their treatment. We've also done work with the community and our staff. In the past 6 years, we have really tried to branch out and cover all different kinds of bases with this program in helping not only the folks in our hospital, but also within our community and those that work within our hospital really understand advanced directives and encourage everyone to complete one. The creation of the work started through the Vice President of Population Health and Advancement, Dr. Elizabeth Etzel-Crom, and she collaborated with the Director of Population Health, who is my boss, Tracy Novak. Before this project even got started, one of the things that they looked at, it started probably a month or two before I was actually hired. So one of the things they looked at was who needs to be involved in this process. You know, like our social work department and our chaplaincy and our representatives from our ethics committee and things of that nature. So they were all involved, and there was a rapid improvement event that occurred to really look at what is happening in the hospital and where are there areas that need improvement. And we developed a work group that met for several months, a couple of times a month, to work through all of the work that needed to be done, because we needed everyone's brain. Everyone works in a different way and has different information and would eventually be implementing this work on a different level. So yes, this was not 1, 2, 3 people. This was a group of people. When I started in late 2016, the Horizon Foundation was very much involved in the Speakeasy Learning Collaborative, which the hospital was involved in. The Speakeasy Learning Collaborative was an opportunity to work with the Conversation Project, which is part of IHI, to really understand what advanced directives were and to develop a plan for how to make advanced directives more prominent in your organization. And there were a variety of organizations involved, some medical, some community, faith-based organizations. And the goal of the collaborative was to identify where there were gaps in this area and develop a plan to fill those gaps. That was definitely one of the pivotal points in starting this work for us. And knowing that these were conversations that were going to be happening around the community through Speakeasy. And we, as the only hospital in the community, needed to be mirroring those conversations. So I would say that the Horizon Foundation really encouraged us to look more closely at our process and help us to educate patients and families more about the advanced care planning process. I think my lessons learned here, the biggest one is don't give up, be persistent. If you are in a large medical system or even not, there are a lot of barriers. It is a process. It takes time. So it can feel a little bit discouraging. And you sometimes maybe lose sight of why you're doing this work. So the biggest lesson I would say is don't lose sight of the importance of that conversation and the support for the patient, and keep that patient or that employee or that family member in the forefront of your mind.